The whooping cough vaccine is recommended during pregnancy to ensure your baby is protected against the pertussis infection as soon as they are born and until they are able to have their routine vaccinations beginning at 8 weeks. This vaccine is recommended after 16 weeks of pregnancy and may not be available at a routine midwifery appointment, but your midwife can advise you of availability in your local area. Both of these vaccines are inactive, which means they do not contain a live version of the virus it is protecting you against.